Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, a deeper look at what it means for the U.S. to cut back on global health investments. Professor Joe Amon is the director of the Center for Public Health and Human Rights at the Johns Hopkins Bloomberg School of Public Health. He speaks to Dr. Josh Sharfstein about why helping other countries fight disease is good for health and security in the United States. Let's listen.
Professor Joe Amon, thank you so much for joining me today on Public Health on Call to talk about foreign aid for health and what it means for national security. How are you doing today?
Good. I'm delighted to be here.
Before we jump into this topic, I just wanted you to introduce your experience in this area to our viewers. Tell us about how you got started in global health.
Sure. So I've been engaged in global health for quite a while now. I went to public health school and then joined the Peace Corps and spent 2 years in West Africa working on guinea worm eradication. After that, I worked on a number of HIV programs in sub-Saharan Africa, but also in Asia and Latin America, and worked also on a broader range of parasitic diseases that are grouped together as neglected tropical diseases, and worked really on a wide range of other issues too, at times on environmental health issues in Africa, on nutrition issues. And it's been quite an experience because I've really had fantastic partners in ministries of health and non-governmental organizations and community groups throughout that experience.
I imagine this must be a difficult time, particularly for you, as you're reading and hearing from people affected by the drastic changes to USAID's funded health programs.
You know, it's really not too strong of a word to call it a disaster. It's a crisis for many people in many countries who haven't been able to sustain medical treatments or get access to the drugs that they take to prevent infections. There have been problems getting access to things like oxygen. There have been people that are just completely unclear whether programs can start up again, whether they should be laying off lots of staff. This affects infectious diseases. It affects chronic disease care. It affects all kinds of ways in which ministries of health in different countries track emerging infectious diseases that could become global pandemics.
I want to first say that there's this very, very clear consequence of cutbacks for the health of people who are directly affected, like you're saying. And then there's this indirect consequence, and you were hinting at it at the end there. You're talking about pandemics, that this funding isn't just about the health of the people being reached. Could you talk about that a little bit more?
Well, one of the things that U.S. foreign assistance has really done is build up the capacities of ministries of health. And part of that is their ability to identify emerging infectious diseases that could become globally relevant, that could become pandemics. And that work isn't work that's easy to do. It requires a lot of vigilance. It requires a lot of training and a lot of research capacity.
In other words, we are supporting other countries in being able to spot diseases that could cross the border and come into our country.
Absolutely. And as a concrete example of that, the work that we've done on polio eradication has been used to quickly pivot and identify cases of Ebola when they came up in Nigeria, for example.
What else in foreign assistance for health is relevant to our own security?
Well, part of it is that we know with climate change, there's going to be new infectious diseases introduced, mosquito-borne diseases, for example, tick-borne diseases, and others that we don't currently have a lot of cases, but that could change. And having partnerships with different countries that have a lot of these diseases allows us to do research in those countries to really better understand how we can prevent these diseases for everyone worldwide, but also for ourselves when these diseases start coming into the country.
There have been cases of malaria in the United States.
There have. Malaria is rare, but there's starting to see some individual cases of indigenously transmitted malaria. There's also infections like Zika virus, Oropouche, which have been in Latin America, but are starting to be seen in some parts of the US as well.
So if we're not working with other governments and other partners to understand these diseases, we're just going to have to wait longer and potentially with more harm to people in the United States.
Yeah, we need a head start. And the way we get that head start is going into these countries, partnering with the government, with researchers in these countries to better understand what's going on and how we can protect ourselves.
And in the process, we're helping the other countries address the challenge right there. And how does that affect, if at all, the relationship between those countries and the United States?
That partnership fosters incredible goodwill. It's a sense of solidarity. It's a sense of partnership that is highly appreciated and really benefits our long-term sense of security.
You have done a lot of work in other parts of the world. Are there lasting impacts from your work that you think improved goodwill between those countries and the United States?
There's a lot of different ways to answer that question. One is that there's personal relationships that I've had with people, researchers in different countries who sometimes come to the US for fellowships or for further research training. It's an opportunity for us to send students abroad to get more trained in public health. There's also benefits at a community level where the reputation of the US is seen in a very positive light. There's benefits at a political level where the contributions that are being made are appreciated by governments. And that help the stability of those countries because they're providing public health and other opportunities for individuals and the community. And that leads to a greater chance for peace and for security.
Let me ask you this. USAID gets cut back severely. A lot of these programs go away. What does unraveling all that mean for our own security? What does that do for the goodwill that this work has generated?
I think there's a lot of confusion right now about why this is happening, about how it can happen, how what had been a long history of support can be just suddenly cut off without any kind of opportunity for transition to other resources. It also opens the door for other actors to come in, and those include China and Russia, which have an interest in these countries for political reasons, to exploit perhaps, minerals or other resources that the countries have, and that jeopardize the long-term investment that we've made in building these relationships.
Not to mention the actual harms of not learning about some of these diseases or not being as prepared for a pandemic.
Absolutely. If we don't get the opportunity to partner with these countries, we won't get, and if we don't, sustain our membership in the World Health Organization, we won't be part of that kind of global alert of what's happening, how we can prepare for it, and how we can defend ourselves.
I've been interested in reading about these huge cuts to global health efforts in the context of people saying, well, a lot of Americans perceive that as a lower priority, for where government funds should be going. How well do you think people in the United States understand the purpose of these investments? And is there a path to connecting, national security to foreign health assistance?
My sense is that there are a lot of people that recognize the value, in part because I think it reflects on American values of being charitable, of having a sense of solidarity with others. Also, from a very pragmatic perspective, it's not just public health that the U.S. is partnering with foreign assistance. It's also things like economic development and farming and ensuring that there's, food aid where there's droughts or where there's famine. And those benefit American farmers. So I think that there is some definite broader recognition of the benefits that occur when these partnerships happen.
And do you think the loss of those partnerships will resonate, or do you think it's going to be a long time before the consequences are really seen?
I think there's some absolute immediate impacts that we're going to see. We're going to see really a sort of lack of preparation, lack of ability to anticipate and to respond and to understand potential threats that could occur.
Professor Amon, really appreciate your coming to the podcast and talking about this connection.
My pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.